Good day, ladies and gentlemen, and welcome to the Employer Webinar Series. All lines have been placed on a listen-only mode. You may submit your questions through the chat box on the lower left-hand side of your screen. At this time, it is my pleasure to turn the floor over to your host, Kent Mitchell. Sir, the floor is yours.
All right, well, thank you so much. Good afternoon, everyone, and welcome to the second in a series of calls from the Alliance for a Healthier Indiana, focusing on how the business sector in Indiana can get more engaged on critical health issues that impact our health, our workforce, and our economy as well. So my name is Kent Mitchell, and I am the Director of Outreach and Engagement for Raise It for Health. We're a campaign to reduce high rates of tobacco use in our state, primarily by raising the state cigarette tax. I'm speaking today, though, on behalf of the Alliance for Healthy Indiana, a coalition that is led by the Indiana Hospital Association, and as you'll learn in a moment, has many other supporters and members from across the state. I just want to recap a little bit of what we're going to try to accomplish today. Again, this is the second in a series of webinars. We did our first one on high rates of tobacco use in our state and how employers can be part of that solution, including through the Raise It for Health campaign, but also through policies that they can implement. And today we're going to focus on our future workforce, youth and young adults. As you'll learn today on today's call from our experts and our speakers, Indiana's youth and young adults face some really significant challenges when it comes to health and health outcomes, including tobacco use, but also many other issues as well. So we won't just focus on tobacco today. We'll focus on young people, their health, and including young adults who are in college or entering the workforce. So you'll hear today from three great leaders in our state who have data, experiences, and expertise to share that is really relevant for you, for business leaders in our state. So before we dive into the topic, though, of our future workforce, I did want to share a little bit more about the Alliance for Healthier Indiana. So the Alliance is a group of dedicated healthcare professionals, advocates, community, and business leaders from across our great state committed to improving health. It's led by some very notable organizations, including, as I mentioned, the Indiana Hospital Association, the Indiana Chamber of Commerce, State Medical Association, Anthem Blue Cross and Blue Shield, and the Richard M. Fairbanks School of Public Health. So why now? Why are we focused on health in Indiana? Well, as you'll see from this graphic, we have a very low rankings in the number of health indicators as compared to other states. And if you look all the way at the end of that list, we're 49th in public health spending. What is public health spending? That's on issues like smoking, drug abuse, infant mortality, obesity. How do we help people in our state, Hoosiers in our state, children and adults, youth and young adults as well, be healthy? We rank very low in our per capita spending there, and that partly contributes to these low rankings in many of these issues. So these are the issues that the Alliance is focused on because we think these are critical and urgent causes, and we need to make more progress on them. So what's at stake? Our health is at stake. We're focused on four main issues: tobacco use, opioid abuse, obesity, and infant mortality. These are issues you read about in the paper. Our governor has discussed these issues at length as well. Our lawmakers talk about them. We have a lot more to do, like I just said, to improve our health rankings and improve outcomes for folks in our state. So I want to get right to the heart of our talk today and our presentations today because we have some great speakers and slides. Our first speaker, and I'll just introduce them here a bit, Charlie Geyer is the Vice President of Impact and Data Solutions at the Indiana Youth Institute. He has been a very active participant in the Alliance for Healthier Indiana, including a series of roadshows that have been happening across the state, town hall conversations to talk about the state of the child as it relates to health. So I want to thank Charlie for being here today. Katie Luger is the founding president and staff advisor to Tobacco Free Blue. They're an organization that is making great strides to help make Indiana State University a tobacco-free campus and also just support the health of the student body and staff and faculty. Katie is a longtime Terre Haute resident and also Assistant Director of Student Programming and Leadership at the Honors College and a doctoral candidate in health sciences. So Katie, thank you for being here today. And then Susan Ryder is an employee benefits and human capital management advisor and consultant with Gregory and Appel. She has a long career advising Indiana companies, and in 2016 was named by Employee Benefits Advisor among the 25 most influential women in benefit advising. So we're really honored to have Susan's vast expertise, on the call as well. So with that, I want to get directly to our first speaker so we can really dig into the state of health for our youth and our young adults. So with that, Charlie, I'd like to turn it over to you for your presentation.
Thanks, Kent. Thank you for including me today. It's been great, being engaged and going around the state and talking to various stakeholder groups about, what is the impact on kids and families when we think about these areas of health. So why talk about these things? Well, first and foremost, we all benefit when the next generation is healthy, safe, well-educated, and economically secure. Health is so foundational to the child well-being in the short term and the long term. If we don't have healthy kids, it's really hard to have great education. It's really great to have an economic impact long term because of health problems. Just health is so foundational to the overall well-being of the child, and health challenges impact the whole family. I know this really well. I'm a father of 3 boys, and when one of the children is sick, it impacts the flow. It impacts our entire day, and we're really grateful that we have very healthy kids. There's no long-term issues here, but a long-term issue impacts families for many years and sometimes generations. And hopefully what we hope is that the conversation and the data that I talk about today, that it sparks discussions that lead to communities taking action. We talk a lot about collaboration and working together, and that is absolutely essential. But I want to push us in our thinking in our communities to think about what does it mean to work in convergence. How do we go a step further with collaboration and really think about the common goals that we have that we can work together towards that's going to have impact? Collaboration oftentimes is sharing ideas, and it can be somewhat self-serving. Collaboration says, what are we doing collectively together? And convergence takes it even a step further. So, I hope that today, as I walk through some of these key areas here, that you find ways that you can lean in and think about how you work in convergence in your local communities. So who are Hoosier kids? In Indiana, we have about 1.5 million kids. Around a third of those children live in single-parent families. We're becoming more diverse as a state, and so around 27% of children are raised to ethnicity other than white, non-Hispanic. Around 10% of our kids speak a language other than English at home. We have over 250 languages that are spoken in our public schools. We have around 12% of kids that live in immigrant families. Now, what's interesting is not only are our kids becoming more diverse, but so are our family structures. Around 18% of children live in a household where that primary householder is not their biological mother or father. So they could be living with a grandparent or a foster care parent. And so our kids are becoming more diverse, and so are our family structures. If I have to sum up kind of where Indiana stands in comparison to our peers, nationally we excel in few, we lag in most, and most importantly, we need to improve in all areas. And so when we look at some of the individual domains, overall, Indiana kids rank 28th, right there, right in the middle. For families and communities, we're 32nd. Economics, we're 24th. This is down slightly from 19th from last year. And education, that has our highest national ranking at 14th. What is really interesting about education is just around 5 years ago, we were ranked 36th. And so we have seen quite an improvement in education. We've also, we think about, okay, why has that happened? Well, we've had a very large state initiative year after year in thinking about improving education, improving choice, and improving options, improving the quality of education. It's well over around half of our state budget, so there's a pretty big financial stake here. There's been a lot of emphasis over the past 5 to 8 years in education as a state, and we've seen our ranking improve accordingly. In health, we're at 31st. When we dive a little deeper into some of the individual areas, you see on the left there the highest 5 fourth grade reading proficiency is our highest national ranking at 7th. High housing burdens is 10th. Indiana's a pretty affordable place to buy a home. You see high school graduation there at 13th. What's interesting about high school graduation is that we really progressed pretty steadily from 2007 to 2012 and then kind of stagnated around 90% or so. The reason that's dipped to around 87%. On the lowest 5, you'll see that we see some key areas around health start to show up here. Our lowest ranking overall in any domain area is child maltreatment. So what that means is that we rank 48th in terms of the number of children that have experienced neglect, physical abuse, and sexual abuse. So what does that mean? That means that there's a new report to the Child Abuse and Neglect Hotline every 2 minutes. So by the time that this webinar is over, we're looking at 30 new reports. And this neglect rate has really risen over the past 5 years, and I'll show in a little bit how this is directly related in many ways to our issues with substance abuse as a state. Another major theme that really comes out when we look across the data is that there's clear disproportionate challenges and barriers that exist for children. And oftentimes we talk about disaggregating data by race, and we see these barriers and challenges exist for race, but we also see them exist for place, income, and immigrant status. And there are critical issues, the 4 that the Healthier Indiana is really focusing on: infant mortality, smoking, opioids, and obesity are impacting Hoosier kids. And most importantly, individuals, organizations, including businesses and leaders, can be a part of the solution. So I'm going to talk through some of these. We look at infant mortality. Indiana infants are 24% more likely to die before their first birthday than infants nationally. Our governor has said, look, this is an issue. We've got to put an emphasis here. He wants us to be the best in the Midwest. When we dive into the data, we see that black infants are 2.5 times more likely to die before their first birthday as white infants. And so not only does Indiana have an infant mortality problem, specifically we have a black infant mortality problem. Looking at the segregated data here really makes us question what can we do in terms of prevention and what can we do that's very specific to certain populations. We also see that disparity when we look at preterm and low birth rate. So what are some of the solutions for infant mortality? Over here in organizations and communities, just a few down, how can we promote cultural competence across the health workforce? What are we doing with our doctors, with our nurses, with our staffers in hospital situations and in healthcare to ensure that they have cultural competence and know what to do with specific populations as one solution to potentially consider. We take a look at smoking. 13.5% of expectant Hoosier mothers smoke while pregnant. That is significantly higher than the national rate of 8%. But if we look at this geographically, by place, we see there are some disparities. In Grant County, for example, 31% of expected mothers are smoking, in comparison to Hamilton County at 2.4%. So once again, it makes us think, what are we doing specifically in terms of our local communities to address some of these issues, as we know they are impacting some communities more than others. Here, as we look at, across age ranges, ages 18 to 24 is where we see the highest percentage of mothers who are smoking during pregnancy. Obviously, these are key ages for women that are having babies. So then what are we doing specifically with this age group? We look at 25 to 34, what are we doing for them? And think about how we might, really think about differentiating our approach. We look at kids. We see the percentage of cigarette use in the past month by grade level in the high school has continuously dropped really over the past 10 years. That's good news. It is still, though, too high. So what does that look like, or what are the perceptions of kids? If we look at the kids that say it's a little bit wrong or not wrong at all, that's their attitude towards smoking, we see 12th graders, nearly 4 in 10, have this particular attitude. And we see that it drops considerably as we go down in 11th, 10th, and 9th grade. So what are we doing with 12th graders? As we know, those who are 17, 18-year-olds are becoming able then to purchase tobacco. How are we targeting them, and how are we being very specific, as we know that that's an essential year, and clearly their attitude changes over time. 6 and 10 high school kids, or seniors, say it would be very easy to get cigarettes. And so for our seniors, they say, look, it's very easy for us. When we look at over the past month, we look at tobacco use from 7th to 12th graders, we see that the highest use is with electronic vapor products at 16.9%, cigarettes at 5.7%. what is really interesting about this is that we have seen an increase recently. In 2016 and 2017, according to the Indiana Youth Survey, we actually saw a decrease when it came to the use of electronic vapor products. But then we see a sharp increase for 2018. Why is this important? Well, we know that electronic vapor products oftentimes do lead to tobacco use. There are adverse effects on health for using these products, and we see this increase in really every single grade level. So that tells us that kids are using the products at a more younger age. So what are some of the solutions? As I look at the fourth check mark here, how can we deliver culturally appropriate messages that target youth to counter the tobacco product advertisements? Those tobacco product advertisements are everywhere. They really are targeting youth. They're targeting kids. If you just go to the gas station, from the moment that you walk in, you are hit with advertisements that are very much that youth may respond well to. They're high in color, they're attractive, and they really show how cheap that this can be. So how can we really think about how we're delivering those messages as one way to think about a solution? When we look at opioids, drug overdoses now kill more Hoosiers than car crashes and gun homicides combined. We're seeing this really across the state. In every community we've gone on the road show, this has been a conversation, as we've seen it impact really every county. If you look at Scott County, it's been hit very hard with this particular issue. Wayne County is very high as well. That's particularly important to me, as that's my hometown, and I've seen, or my home community. I've seen how this has impacted families, friends, and the community. So what is the impact on kids when it comes to opioids? Well, there's prenatal exposure. This certainly has an interference with parent-child relationships, and there's an increased risk of child maltreatment. As I mentioned earlier, you see this sharp increase in child maltreatment, and we look at then the percentage of kids that were removed from home because of parent drug or alcohol abuse. It's 50%. So over 50% of kids are being removed. The kids that are being removed from home are being removed because of drug and alcohol abuse. Look, substance abuse affects the whole family, and kids oftentimes what we consider the hidden victims. So you may have an adult in the household that is struggling with the addiction, but that is impacting the child tremendously. As you look at the interference with parent-child relationships, it may create adverse childhood experiences which have a compound effect over time. So truly, when we think about the impact on kids, the kids oftentimes are the hidden victims. So what can leaders and policymakers do? One particular area that we're really leaning into is how do we include the entire family in policies. So it's one thing to look at prevention, it's one thing to look at what we're providing those that are struggling with the addiction, but how are we addressing the entire family in our policies? Obesity. 1 in 3 kids in Indiana are obese. What's particularly interesting about this is that 9 in 10 parents will say that their child is healthy. So there's a clear disconnect between health and really how many kids are obese. Oftentimes we'll hear parents say, oh, our child is big boned, or he'll grow into his shape or his body or his size. And so really, how do we then think about how we're educating parents and realizing that we do have health issues for our kids? The CDC recommends that kids and children and teens ages 6 to 17 get an hour or more of physical activity each day. But when we look at what is truly happening, we look at the ages 12 to 17, just under 20% of kids, so less than 1 in 5 kids, are having exercise every single day, which is recommended. Our kids are sitting still. So the question becomes, how can we ensure that kids are getting vigorous physical activity, not only at school but at home, and that is essential to ensure that our kids are healthy. Lack of access to low-quality, healthy foods is also an additional issue and does contribute to obesity. 1 in 5 Hoosier kids are food insecure, and we see that by county. Once again, there is disparity here. So in Fayette County, nearly 24% of children have food insecurity in comparison to, say, Hendricks at 13.3. Oftentimes we see that kids in Indiana are food insecure. 1 in 5 kids are in poverty, but also 1 in 7 kids live in what's called a working poor household. And so these are kids who are living in households where they make just enough income to not receive any kind of assistance. So if you look at the income for the working poor, and you look at those who are living in poverty, almost 40% of kids are living in a household where there's an economic hardship. So what is the state of health for Hoosier Health, for our Hoosier youth? Look, nationally we excel in few, we lag in most, and most importantly we need to improve in all. There are clear disproportionate challenges and barriers that exist, and the 4 areas that we're talking about today, infant mortality, smoking, obesity, and opioids, they are impacting kids in a big way. It's in all of our best interests to make sure each and every child is getting support that they need to reach their full potential. So what are some quick solutions or what's the call to action here? Well, communicate the key data and the solutions. It's going to take all of us working together in convergence in our local communities. How do we promote access to the data and services that you provide? How do we create collaborations that actually make a difference? How do we take action? And we all have a sphere of influence. And how do we maximize that sphere of influence to really promote these things and to promote change? And most importantly, to learn more. IOI is here to help in this. We see ourselves as a partner across the state. We've been around for 30 years, really being an ally and a catalyst with communities to really think deeply about how we can impact the well-being of kids. So, Kent, thanks so much for allowing me to share a few of the data points and some of the solutions that we're thinking about as a state.
Okay, well, thank you so much, Charlie. As always, a very data-rich, presentation and a lot to chew on. I think one reflection I've had with these town halls and our engagement with business leaders across the state is that they certainly view our youth as our future workforce, our children and our youth, but it's much broader than that. This is just about the future of our state generally, and it's also about the employees' well-being as it relates to their family and what the family is going through health-wise as well. So I think I see some really urgent issues here, and I did want to take a moment to ask you a question. You have a lot of data about some of our poor outcomes and some of the needs in the state. The other way we look at public policy, of course, and solutions is, where do you get the best bang for your buck? And that's really the language of business, return on investment. So when you think about starting earlier and starting with kids, what have you seen in terms of return on investment, or what thoughts do you have there that you can share with our audience today?
Yeah, something that comes to mind is really thinking about that statement that I made earlier, which is health is foundational. And so when we make the investment early in children, ensuring a healthy foundation, that just sets them up for success, and really it compounds over time. We think about physical and mental health, if we're dealing with these issues at a young age and we don't address them well, these things go long into adulthood. As I talked about the adverse childhood experiences, for those kids that experience, this trauma or these experiences, that impacts their whole life. And that certainly affects then the worker, that affects the workforce, the quality of the worker. And so that's the first thing that really comes to mind. The earlier we start, the more a stronger foundation we set up for success long term, which then in turn, we get a better return on our investment long term as we have healthy workers, through their entire life. Something else that kind of that I think about in this particular area is our kids they become adults someday as well. And so if we can instill in them a healthy lifestyle, then they in turn will hopefully instill a healthy lifestyle for their families. And so you see this becomes a generational thing that year after year can pay dividends if we start young.
Okay. All right. Well, thank you so much for your presentation, Charlie. Really appreciate that. I wanted to move on to Katie Luger to talk about Tobacco-Free Blue. I think the nice transition here, we've now heard a lot about data about children and youth in our state, and Tobacco-Free Blue is a campus-based effort. And so, Katie, we're excited to hear from you today about what you're doing on youth and young adult use of tobacco, and also observations that you have about health generally among our college-age population. So I'll turn it over to you.
Well, great, Ken. Thank you so much for having me today. So again, I'm Katie Luger, and I am with our student-led organization, Tobacco Free Blue, and we were founded in the fall of 2015. A group of us got together and realized that tobacco use was a huge problem on our campus. We don't currently have a tobacco-free policy. It says we do, but there are exceptions that we can use tobacco products in designated areas and in private vehicles, which in turn negates the tobacco-free policy when it's not enforced and when there's little compliance. So a group of students got together and we founded Tobacco Free Blue, which is, again, a student-led organization advocating for the adoption and implementation of a comprehensive tobacco-free campus policy for Indiana State University. And the idea for all of this is to promote the health and well-being of all students, faculty, staff, and visitors at ISU. We recognize that we have a really public space on our campus. We house a lot of community events, and we have a lot of foot traffic of potential students and families, as well as the general community for a lot of campus events who are then in turn exposed to tobacco, secondhand smoke, and cigarette litter. So we're not trailblazing here with our movement. There are a lot of universities and colleges who have already gone tobacco-free and have been tobacco-free for quite a while. So as of April 1st, 2018, there are over 2,000 100% smoke-free campus sites, and 1,800 of those are 100% tobacco-free. And the distinction there is really to focus on incorporating all tobacco products, whether they are smoking products like cigarettes, smokeless tobacco like chew, and then incorporating e-cigarettes as well. So you can see there are a lot of Indiana institutions who have tobacco-free policies and currently other universities who are moving in that direction as well. So in spring 2016, we decided we need to have some more insight to what our campus really looks like in regards to support for a tobacco-free policy. So we sent out a campus-wide survey, and out of our 14,000 students, we had about 1,600 participate. And so out of those participants, we found that 2/3 were supportive of a tobacco-free policy. But we also learned that the same amount were concerned about exposure to secondhand smoke, and they were concerned about cigarette litter. They were also unsatisfied with current compliance and enforcement of that policy, and they felt that universities have a responsibility to adopt a tobacco-free policy. So that really gave us a framework from where to go and what specific issues to address and how we can effectively advocate for the students, faculty, and staff who took this survey to address their concerns to our governing bodies. So our policy falls under university-wide policies, and we made a few recommendations to our Student Government Association, Staff Council, Faculty Senate, our President, and our Board of Trustees. So overall, we suggested a removal of the exception to the tobacco-free policy, which would not include the designated smoking areas or use of tobacco products in privately owned vehicles on campus property. The idea is that we have a lot of parking lots, but when someone uses a tobacco product inside their car, such as a cigarette, a lot of times once that car door opens, there's a puff of smoke that comes out with it, and a lot of times there's cigarette litter as well. We would like to use a model policy that has been developed years beforehand and is really the ideal of what we are going for, because they include a clear definition of tobacco products and address issues of loopholes, enforcement, and things like that. ISU is in a unique campus in the fact that there are several streets that run through our property that are city-owned versus campus-owned. So that would include a discussion about how to provide coverage for those areas and how we would enforce the tobacco policy in those areas. So that would take a larger conversation with our city as well as our community neighbors who maybe sit on the opposite sides of those streets. We don't want to push tobacco use into their area as well. So we would also like to increase awareness initiatives to promote compliance, as well as increasing access to cessation resources. We currently have a lot of staff benefits for tobacco cessation, but currently we're lacking a lot in our student benefits as well. So we would like to have a conversation about what we can do for students in that regard. We need to increase signage on our campus. Currently we have none. There are only a couple signs here and there on campus buildings, but we have no signs on our designated areas to let anybody know that that's what their purpose is for. Right now they just kind of look like bus stops. So we would like to increase banners, signs, notices, even on parking tags to remind everyone of a new policy and preparing them for change to a new policy. We would also like to incorporate referral cards into promoting compliance on campus. So instead of using a more punitive approach, we have readily available information about cessation options, benefits to cessation, and ways that they can connect with human resources, student counseling centers, student health promotion to have access to cessation tools. Videos and online sources are a great option to really connect with our mobile-friendly students, and then having more enforcement considerations. Right now we have more of a soft approach where the hope is students, faculty, and staff will confront one another and hope to promote compliance that way, whereas some campuses incorporate fines up front or other approaches to combat any violations to the policy. But what we know is that tobacco-free policies are very beneficial for all persons who visit campus. It reduces tobacco use. It increases productivity of faculty and staff for issues with breaks during the workday. It reduces exposure to secondhand smoke and it reduces cigarette litter on campus. And what we have also learned is that it significantly impacts our grounds and facilities management staff. They spend a lot of time picking up cigarette litter, but it's all returned within the same week and even sometimes overnight. So it takes a lot of time out of their day to clean that up when it just returns very soon. It is also very helpful to have clear expectations for compliance and simplifies the enforcement process. And overall, it helps individuals who are trying to quit using tobacco because it keeps people accountable and it helps provide readily available resources for cessation. So this directly connects to our strategic plan. So in our approach to connecting with our governing bodies and the Board of Trustees, we wanted to tie how a tobacco-free policy directly impacts the mission and the strategic plan of the university to benefit all students, faculty, and staff. So there is no found evidence for negative impact on enrollment or applications for new students or international students. It prepares students for tobacco-free workplaces. We have a strong emphasis on career readiness on our campus, and one of the realities of our changing world is tobacco-free workplaces, and we want to make sure that our students are set up for success in that regard. It also increases student participation in our community engagement activities, including campus cleanups. Our campus has been in the top 3 for community engagement and service and volunteer opportunities for the past several years, and continuing that tradition is making sure that we are taking care of our campus in our neighborhood as well. Again, it promotes overall sustainability through reducing cigarette litter. As we know, public health funding is not so great in our state, so we are actively applying for grant opportunities to help support tobacco-free policies in the adoption and implementation process. And again, it really helps to recruit and retain our great faculty and staff. There's a potential increased enrollment in tobacco cessation programs, which can also reduce any surcharges on their health insurance. There's a potential for a healthier tobacco-free community, and tobacco-free policies are also attractive aspects for new employees, as well as potential students and their families. So Tobacco-Free Blue has done a lot throughout the past few years as far as our outreach efforts and gaining support. So we do a lot of tabling events at health and wellness fairs and events, and we've gained around 2,000 plus signatures, as well as quite a few letters of support from our campus community as well as state leaders. We've hosted several town hall meetings, one with a couple university representatives who have gone tobacco-free to learn more about the barriers and challenges as well as successes on their campuses. We partnered with our African American Cultural Center and the NAACP at ISU to talk more about menthol cigarettes as well as how tobacco companies specifically target communities of color. We had another town hall specifically for international students, which was heavily attended by our Saudi Arabian population, where we answered questions about the culture of tobacco use and ways to address tobacco cessation among our international student population. We also hand out quick kits to people who are interested in quitting their tobacco use, which have proven very successful. They have information about the benefits of cessation as well as referrals to the Indiana Quit line, and then they have some tangible little trinkets in there as well, like bubbles, pinwheels, gum, mints, and things like that to facilitate the cessation process. So one of my favorite things that we do as an organization are campus cleanups where we focus on cigarette litter on campus. And it was pretty astounding. On Earth Day last year, two of us, it was very small, two of us went out, and in an hour and a half, we picked up 2,400 cigarette butts on campus. And the astounding thing is that was only in 2 locations on campus. One area surrounded a designated smoking area, and the other was by our library, which does not have a designated smoking area. So it was a clear demonstration that people are not using the designated smoking areas as they were intended to be utilized, and there is a significant problem with cigarette litter. Even more so, during homecoming last year, in 2 hours, 13 volunteers gathered and collected 4,600 cigarette butts across our entire campus. So it's not just limited to those areas. It's happening in parking lots, on the outskirts of campus, outside academic buildings, and residence halls as well. But we are hopeful. We've had some recent updates to our movements. We have active support from our ISU president, who just recently convened our tobacco-free task force. So we have university support, and it's composed of students, faculty, and staff, and community partners to help talk about and develop and adopt and implement a tobacco-free policy for our campus. So we are so excited for this future for our campus. We've applied for grant funding, which we hope to hear about soon, and our goal implementation date, which was set by our president, is July 1, 2019. So we're excited to get moving and help transition our campus to become the healthiest version of ISU it can be. So thank you, Kent. We are just so excited to progress our campus.
Thank you so much. I mean, it's such a striking, presentation of a really comprehensive and really in-depth effort to get a really important policy passed on a place where, thousands of our young people will spend, up to 4 years or more on that campus. And we want them to be surrounded by a healthy environment. And we want that, of course, for your faculty and your staff as well. What's striking to me too, is since we're focused on business and employers, is that certainly we want young people to be on college campuses that are healthy and promote health so they enter the workforce healthy. But the same debate you're having about being a smoke-free campus is the exact same debate that many employers, including manufacturers in our state, have. Can they go smoke-free? What will that do to their talent retention or recruitment? The same kinds of things that they are grappling with, you're methodically grappling with. So you could almost strike ISU and put name of Indiana company in there, and this is like a playbook for Indiana companies. Before I move on to Susan, I did want to ask you, we know tobacco use and smoking often isn't just about being addicted to nicotine. It can be related to other health issues or concerns, including stress. So I'm curious, what do you see or hear from folks on your campus about why they smoke, why is it hard to quit, and any other health issues that you would want to share with the group here that you see among our college-age population?
Sure. One of the great things about ISU is that we are having a spark in conversations about mental health on our campus. And our Student Counseling Center sees a majority of our students and at a really reduced cost. And what they are seeing is that the top 2 reasons for visits at our Student Counseling Center are anxiety and depression, followed by stress management. And along with that, many of our students are expressing use of tobacco as a coping mechanism and e-cigarettes as well. And so we're starting to have this conversation of how we can provide more support to our Student Counseling Center and how we are effectively addressing the concerns that students have to create a more successful environment for them, and then also addressing tobacco as well, because sometimes that's left out of whether it's treatment planning or programming, and so we want to make sure that we have that emphasis on tobacco, because it is shown that when we include tobacco cessation in treatment planning as well as health programming on the campus side, it can significantly benefit the mental health and overall wellness of our students as well as our faculty and staff.
All right. Well, thank you so much for that perspective, and appreciate your presentation. So I wanted to turn it over to Susan to talk about workplace wellness and her observations about Indiana employers and how they can be engaged. Susan?
Thank you, Kent. So I think you will see rather some common themes in this presentation as well that transition quite similar to what Katie's efforts are at ISU. So if we think about an employer, people tend to join an employer based on their culture or its perceived culture in the community. And one of those things during the recruitment and retention efforts of an employer is really what is that wellness culture that ties back into every policy and procedure that they create. So when we look at health insurance, HR policy structure, things of that nature, when the CEO or the president and the managers all buy into the same strategies and align those more with their overarching strategic plan and initiatives, we see better success. So when an employer is thinking about, hey, what are some of our competitive advantages, and specifically what are competitive advantages related to our wellness program, there's one workplace study that had nearly 4,000 employees. 88% of those individuals said that having health and wellness programs did factor into their decision as to whether or not they were going to lean in that direction for employment. If we think about some of those really big technology companies that we hear a lot about in the news, Google, Microsoft, Facebook, they have or even here in Indiana, Salesforce as an example, they have incredible benefit packages, a lot of perks that they're able to provide. And many times our smaller businesses are asking me as an advisor, what can I do that's similar so that I can compete for some of the same talent? So the benefits really of a wellness program are, go far beyond just wellness and keeping our people healthy and making them loyal to us, so on and so forth. But what they're actually doing is that wellness programs, when deployed appropriately and when they have the support of the senior leadership team, it actually helps improve the benefit program that they are offering. Because people that are engaged in wellness typically are healthier individuals. Typically, they are the people that seek the appropriate care at the appropriate place. And as you keep costs down for an employer, they're able to share some of that savings with their staff, so then their benefits themselves are less expensive for a new hire. So as we're transitioning from a college-age student into the workforce, they're looking for things that are affordable based on where their salary are. So there was one research study that determined that companies with a wellness program have a 9% attrition rate compared to 15% at companies without one. There's also a factor in regards to turnover, where morale is higher when people are engaged in those wellness programs. when there's friendly competition involved, when you're changing the scope of wellness from year to year, you're really keeping people more engaged in the process. And then, of course, from an HR standpoint, the evidence speaks from the claims experience that they're evaluating from year to year, where they can see continuous improvement of their population based on different things that they're engaged with. The third advantage of having that vibrant wellness program is really just having those testimonials of individuals who are able to share their story. So when you have someone that may be slightly unhealthy and they become engaged in wellness and there's a dramatic improvement and they're willing to share what that experience has been for them and the benefits, I think that really is what helps engage others. So we're sort of following what other people are doing or modeling those positive behaviors to create some change. Some fun things that we've seen at many of our companies that we work with, more on the innovation side, on-site yoga classes, cooking demonstrations, especially, for groups that have large diabetic populations or have significant obesity concerns. When you bring things like a cooking demonstration that shows how you can access healthier food items, how you can create dishes that taste good even when they are healthy, I think that helps embrace and translate into things that folks can do in their home life. Providing workshops, on-site massages, as people experience these different levers, and not everything is of interest to every individual. So you've got to have many different choices. But I think not only then will you engage your staff, but you're also showing them that you're willing to listen and you're willing to offer things that are more on the variety spectrum. So one question that you had posed to me prior to this recording was, what does this really look like for a new hire and how do we really engage them from the beginning? So again, I think it's really important to have that new hire orientation encompass things such as what is our wellness philosophy here at company ABC? How can we better embrace the benefits that we are already offering you, but then how can we expand that so we offer more of a holistic approach? So as we all know, healthcare reform expanded preventive screenings. Depending upon your age and gender, these are all covered at 100%, meaning that the employee and their family members who are enrolled in the plan don't have to pay for it. The plan is paying for it. However, what we see is that many people don't take advantage of the free benefit offering that's available to them. We also see that many employers have then taken it sort of a step further and offered a more structured approach to wellness in addition to what's built into their health plan. So offering that health risk appraisal where you're asked a series of questions. One expanded area that we've seen is questions about safety, things regarding stress management, so on and so forth. And as employers get more of that aggregate data, that helps them determine future offerings, such as maybe expanding their employee assistance program. We see a lot more organizations that are bringing those biometric screenings on site. So you have your captive audience on site on average 40 hours per week. And so why not bring the screenings to them where they are so they are more productive in the workplace? Offering more tobacco cessation programs and stress management programs on site during normal business hours, so you're trying to alleviate that obstacle for those that might have challenges with transportation or whatever their scenario is. Having an on-site gym or providing discounts to gyms Many fully insured carriers these days do provide some of those discount programs, but again, it comes down to communication. So making sure that your employees are touched with small little snippets along the way throughout their journey as an employee as to what those benefit offerings are. Maybe changing over your break room or cafeteria within an organization so that you're only providing healthy options. So again, you're removing that barrier, if you will, to determine, do I want something healthy or something not healthy? If you only offer healthy options, then someone's going to probably choose that. And then really looking at what community resources are available. So within our client base, on a regular basis, during open enrollment meetings, during new hire meetings, we're helping employers educate their employees about the quit line and trying to remove some of those obstacles to access some of those programs. And then aligning the formulary lists with the medications that are proven to have better results in regards to tobacco cessation. As I mentioned before, we're seeing many more employers that are expanding their employee assistance program, which is also known as an EAP. Many employers are now bringing mental health providers on site because in our state, we sometimes have trouble accessing a mental health provider based on their hours of service or how long it takes to get an appointment. And we don't want someone not to get the attention that they need, which I guess is pretty appropriate since we're in the Suicide Prevention Month currently here in September. But other employee assistance programs, which are typically tied to a life insurance or a disability policy, those are free and they do give folks access to telephonic counselors over the phone, but sometimes, as we all know, in a crisis, we just need a live body to listen to us. So part of my role here at Gregory & Appel is to help businesses create model policies so that they can become tobacco-free. And so I use resources that are available to me through organizations that are subject matter experts, such as the American Lung Association or American Cancer Association, or whatever the scenario is, so that a business doesn't have to create something from scratch, so that they get information that's been approved or that has been shown to be effective, so on and so forth. So this is a very brief model policy for becoming a tobacco-free location. Oops, I skipped the slide, sorry about that. Really listing out sort of what are those definitions and making sure that they're relevant for your organization. This includes, can tobacco products even be allowed within a facility or at a location? Can they even be used in any type of vehicle? What do brakes look like? So on and so forth. And so I think it's really important that we also then take it one step further and look at those procedures that would take place. So how do we educate the managers and our staff as to what the procedures are to become a tobacco-free campus? So how are employees informed about the policy? Do they sign off on the policy? Is it in our handbook? Is it posted to the website? How do we address it with visitors? So on and so forth. And I think a lot of these same common themes came out in Katie's presentation as well. So really just sharing best practices. And then really helping employees understand what are the benefits to me. A tobacco-free environment helps create a safer, healthier workforce. Workers who are bothered with smoke will not be exposed to this at work. Tobacco users who want to quit, they now have another reason to do so. Those who use tobacco, they might appreciate a very clear and concise tobacco policy. that helps them really understand what they can or cannot do and what those requirements are and how they'll be addressed. The benefits from an employer perspective, the number one is exactly the same, but also what the employer can measure is they can measure claims experience between a tobacco user and a non-tobacco user through aggregated claims experience. They can see how much those individuals cost the company. It helps them create some policies and strategies as to enhancing their disease management. Many times people smoke because they're depressed or they're stressed or their anxiety levels high or whatever their scenario is, and so are there underlying situations that we need to address as an employer. Our office equipment is better managed, carpets are cleaner, furniture lasts longer, there's lower risks of fires when people aren't bringing lighters or cigarettes into the office, even if they're in someone's purse or pocket. It's possible to get lower rates on health insurance. One of the factors under healthcare reform that can still be rated for is tobacco status. Also, life insurance claims, disability claims, these are all reduced when we address tobacco. So smokers are estimated to cost employers nearly $6,000 more per year than a non-smoker. Pretty alarming. Work sites that allow smokers spend $728 more per 1,000 square feet on the maintenance costs of their work site. So if we take a business that's 12,000 to 19,000 square feet, that's an extra cost ranging between $9,000 and $14,000 annually. Smoking increases the risk of fires and injuries, and it also can increase health and building insurance costs by up to 30%. So one strategy that many employers are taking on their health insurance is that they're adding a tobacco differentiator, meaning that there's a tobacco rate versus a non-tobacco rate for their health care. Smoking breaks. Many employers come to us and they say, hey, we need to increase productivity. What are ways in which we can do that? Well, people that use tobacco products tend to take a few more breaks than those that don't use tobacco products. So if we think of Americans within technology, wholesale, retail, finance, and insurance, they spent more than an hour and 20 minutes each day on smoke breaks. Those breaks equate to over 40 hours a month and more than 20 days every year for their industry. That's pretty alarming. When most companies, they have a break period established that you can take 2 15-minute breaks a day. Sometimes with Mental Health Parity Act and addiction rules and things like that, and ADA, all those things compounding kind of impact the way in which you can manage a break period for tobacco users. And that's all that I have.
All right. Well, thank you, Susan. Really striking presentation as well about how to address tobacco use, but also, how it can be a strong competitive advantage, for employers to have a strong wellness program, to really reach out to young workers in that way. We know we're in a strong economy. The race for talent is really hot right now in our state. And so any differentiator like that not only can help recruit, but can also reduce costs, like you said, over time. So I want to do a little bit of group Q&A here for maybe 5 or 10 minutes. And one thing, you talked about, and everyone sort of talked about, is messaging to young people. And I wanted to ask each of you that. Katie, I wanted to start with you, if that's okay. And just because you do so much mobilization and engagement of young people on this issue, do you have examples or tips for business leaders that about how to communicate with young people about health or changing their health behaviors? What have you seen that works?
I have absolutely seen that when administrators, business leaders invite youth and students in on the conversation, they see better results. So including those students with a place for them on a task force, and having them help make decisions about health programming and decisions for the business or the school or whatever might be happening, having their ideas, their concerns brought to light and at that planning table is probably one of the most important and best ways to engage them. And it really carries along a lot further as well because of those peer-to-peer interactions that happen afterwards. Those interactions cannot be underestimated, and it sounds so simple, but it's so impactful. So really inviting them to the table and then having them in leadership roles in that and encouraging them that they can make a difference and using their current strengths, talents, and skills to do so. So it really just depends on that specific person of what they can bring to the table, but at least having a space for them where they can voice what they want to see change is so important.
Cool. Thank you so much. Charlie, you work with thousands of youth workers across our state who care about young people and their health. What do you see in terms of good practices for engaging them in these conversations? What advice would you have for corporate leaders?
Yeah, I think I'm going to second what we just heard, which is the idea that you have to raise up the youth voice. You have to engage them, making it meaningful. And I think that oftentimes we think it has to be something separate, but I wonder about how do we embed this messaging and this work into what we're already doing, so that it isn't seen as something separate, but we see that, look, my health is utmost and to the importance. It's foundational, and it's kind of woven in. And I think it's important that we engage youth in leadership, we engage them in action, and we also engage them and we embed it in kind of all that we do. And we think about that idea where the CDC says you need an hour of vigorous activity every day, and our kids are sitting stagnant. So instead of saying, okay, this is my 1 hour to get my activity, how do we engage kids in vigorous activities throughout the day and throughout their different activities, before school, after school, in school? So I think then it becomes a lifestyle and it becomes a bit of a rhythm, and it becomes of who they are and their identity and their culture. And so as we work with youth, how do we continue to use youth development and include ensuring that health is at the forefront? And I think we do that by really embedding it.
Thank you. Susan, the workplace of today is not the workplace of yesterday. We have new technologies. Things are always changing. HR rules and ideas are changing. When you think about best practices for communicating with young workers, what are companies doing? What do you advise them on? How do they communicate? How can they communicate authentically to drive partnership?
So one thing that we've seen sort of in the wellness realm with any business is that they are forming wellness committees, and those wellness committees are really driving what programs are offered. And they're trying to bring employees from multiple departments. Those are the ones that are most successful. So all different age brackets, all different roles within the organization, so that everyone has a voice, and then taking those ideas and really helping to execute the plan of deployment with customized communication strategies, maybe now incorporating some texting. Adult learners learn in many different ways, so the more times we see it, hear it, touch it, the better the participation tends to be, and then really measuring the results of any programs that we put in place so that we make sure we're getting the value that we hoped and desired from the program that we just paid for, right, as a business. So again, just forming those committees so that everyone's voice is heard, creating customized communications that make sense for that organization, and then really measuring the results of any programs that are put into place.
Okay. Thank you. Susan, I want to stick with you. Charlie raised a really important consideration that, health is not just healthcare. Health varies by race, by place, and in your case, I would also probably imagine by those factors, but also by industry. So I guess when you think about like disparities or health disparities in the workforce or workplace, does that come up a lot in your advising and consultation? And what do you talk to companies about with respect to those disparities, which very well, of course, may be present among young workers, too?
So I can speak for our organization specifically. We have a lot of diversity and inclusion efforts that we've established from the top down. We've also established sort of our wellness strategy, if you will, and we're pretty methodical in how we deploy that so that everyone feels like they can be included and everyone can participate in any of the programs that we offer. And when I say wellness, these are things that would help anyone, not just one particular segment of our population. So, when you're a business or an employer and you're trying to find a program that's most impactful, maybe it's something as simple as deploying things related to nutrition, which help address diabetes, helps address obesity. It helps, when we eat well, we feel better, so it helps with the mental health as well. And then bringing those resources to the place of business. So as an example, we get fresh fruit delivered to our office. Everyone has access to it. We all know it's delivered on Mondays. We have it for the rest of the week. We've added refrigerators. We've tried to make things fun. Some departments go out as a team building exercise. They're encouraged to bring a sack lunch that's healthy, and they walk over to the canal, so they're having a healthy meal. They're incorporating physical exercise, and our leadership participates in all those activities as well.
Excellent. Well, I want to end our conversation today with a specific question about the cigarette tax. So that is a policy that is the top policy priority of the Alliance for Healthier Indiana. Just to give our listeners some background who haven't heard about it, it would make a significant dent in our high rate of smoking. It would help 70,000 adults quit, 60,000 youth would be protected and never start, and even more so, it would generate well over $1 billion over 5 years. That can move us from bottom 10 in public health spending to top 10 in public health spending. So you can tell I'm an advocate. That's our campaign, Raise It for Health. But I'd like to go through each of you and just give your views from your seat, starting with Charlie, then Katie, then Susan. What is it about the cigarette tax that would make a difference from your seat, from your vantage point? Why do you support it? Why does your organization support that? Charlie?
Yeah, the idea of prevention, right, so that we have kids that never start. And we know that, cigarette smoking it causes so many issues, and let's not even go down that road. Let's prevent it from happening. And we know that raising the tax is a barrier. Kids don't have money, and so if you raise it and make it too expensive, it's one more way for them not to get it. I'm also particularly intrigued by the opportunity of $1 billion and how we might invest in youth and how we might invest for families as a state. So I think it's the idea of prevention, and let's not even get going down the road. And this is one way an effective way to do that.
All right, thank you. Katie?
Well, I definitely believe that it takes a combined effort to fully and comprehensively address tobacco use. So it takes a combination of those efforts, from tobacco-free policies to raising a cigarette tax and raising the minimum age of purchase, right? And so all of these combined efforts can really help our state and our country. So an increase in the cigarette tax is going to reduce sales. We know that. And a majority of our students are already in a bind financially. They're paying tuition, they're paying for housing, they're trying to save money for their future, and along with that comes those health care costs. But with the reduction of sales, because of the raise in the cigarette tax, less funds would be going to cigarettes and future health care costs. And overall, we'd have a more holistically healthy and well environment, and specifically for our campus and for universities, businesses, and as a state as a whole, it's a better place to work, learn, and live. And we're preparing our students for a future of tobacco-free workplaces and environments as a whole.
Great. Susan.
I think to go from a different perspective maybe, I think that what the tax will allow is that we can have more intervention from our public health partners. So really creating that strategic public-private partnership, as we've done with other programs in our state before that have had great success, creating communication pieces that have the scientific backing that employers can simply take, if you will, and implement at their organization so that they don't have to create and think about what is the messaging that I need. And then for those employers that are in more of the rural areas, I think it's really going to bring a lot of great new programming and resources to them that they may not have access to just because of the nature of their location.
Mm-hmm. All right. Well, thank you all for your views on that issue, a very important issue for our state and a huge public policy debate we're having. Encourage all our listeners to get involved by joining the Alliance at healthierindiana.org. You can click on Join Us, and also to share your support on social media platforms. Finally, also for those listening, you can join Raise It for Health. We have a site that's specifically for corporate leaders and focused on the economic and workforce impacts of smoking. It's called SmokingHurtsOurWorkforce.com. Encourage those on this call to view that website, get a little more educated, and join the campaign. With that, I wanted to thank each of you, each of the presenters, Charlie, Katie, and Susan, for your views today. It's been an extremely rich experience here, and thank you for all you're doing to improve health in our state. And with that, that concludes the second in our series of calls for business leaders from the Alliance for Healthier Indiana, and wish you all well. Thank you so much.